First, when we received the machine, we have the DPL handles, 500 nanometers, 550 nanometers, and 1300 nanometers, 3 handles optional. And the eyeglasses for patient and operator, funnel to add water, screwdriver, foot switch. Now, before use the machine, we need to add water first. Please add enough water by this water inlet. The water inlet is here. Insert the funnel and press it. Then release it so it won't fall out. It will make a sound. It won't fall out. It means it is already installed. We can add water. Add purified water. Until it been full. So what state is full? This is the overflow. If water keeps flowing out here, it means it is full. After filling up, we can remove this funnel. Click here to pull it out. After that, we can install the handle connector. And it has 2 black water plug inside it and inside the machine. We need to take out it before install it. And this also need to take out here. OK. So when hear a sound and then OK, unlock. Put the handles well in the holder. Now let's turn on the machine and check the interface. It only have one connector to plug the handle, so if you need to change them, you must turn off the machine, and then replace the handle. 1. The 500 nanometers wavelength is effective in targeting melanin, making it suitable for treating pigmented lesions such as sunspots and age spots. It helps in breaking down excess pigmentation in the skin. Besides, it can also be used to treat vascular conditions like rosacea and spider veins, as it targets oxyhemoglobin in blood vessels, promoting coagulation and reducing redness. This wavelength is particularly effective for enhancing overall skin appearance. Besides, can help reduce acne by targeting the bacteria responsible for acne breakouts while also reducing inflammation in the skin. It has 2 modes, SVL and VL mode. Now, SVL mode, it means longer exposure, which can lead to more significant thermal effects in the target tissue. It is particularly effective for deeper skin conditions and may provide better results in terms of collagen stimulation and overall skin rejuvenation. Longer pulse durations may enhance the treatment of vascular lesions and other skin imperfections by allowing more controlled energy delivery, potentially leading to higher patient satisfaction and improved skin texture. It has pulse widths of 30 seconds, 10 seconds, and 1 second optional in this machine. While VL mode tailored for rapid pulsing, which minimizes thermal damage to surrounding tissues. This mode is typically used for superficial treatments, such as acne scars or pigmentation issues. The quick pulse duration can reduce downtime for patients and may be more comfortable during treatment. However, it might not penetrate as deeply as the SVL mode, potentially resulting in less dramatic improvements for deeper skin issues. It has pulse widths of 10 milliseconds, 12 milliseconds, and 15 milliseconds. The choice between SVL and VL modes should be guided by the specific skin condition being treated and the desired outcomes. Each mode has its strengths that cater to different aesthetic needs. 2. The 550 nanometers wavelength is often employed in light-based therapies for skin rejuvenation, acne treatment, and vascular lesions. It effectively targets specific chromophores in the skin, promoting healing and improving skin tone and texture. This wavelength can also be used in phototherapy for conditions like psoriasis and eczema, where targeted light exposure can reduce inflammation and promote skin health. 3. The 1300 nanometers wavelength falls within the near-infrared range, making it suitable for applications such as thermal imaging and non-invasive tissue analysis. It is often used in medical diagnostics to assess tissue health and detect abnormalities without invasive procedures. 1300 nanometers lasers are utilized for skin tightening and rejuvenation treatments. They penetrate deeper layers of the skin to stimulate collagen production while minimizing damage to the surface. Besides, it is also significant in OCT systems used for high-resolution imaging of biological tissues, particularly in ophthalmology for retinal imaging. Now let's talk about the practical operation. In practice, we first clean the face of the customer with clean water. Then clean the face with facial cleanser. Then start applying a thin layer of gel. Apply gel evenly. After applying, put on our eye mask. For some customers, we can put on the cotton pad underneath the eyes to avoid leaving marks. Now let's take a look at the actual operation. This is the handle of 1300 nanometers. We select the suitable low energy, then you can operate it. It is a continuous light. When we are doing, just slide it. By sliding, or in a circular motion, it will feeling some heat. As long as your customer can accept it. The same goes for the forehead. In a circular manner ways to move. Just keep your foot on the foot switch to make the handle work continuously. Avoid the customer's eyebrows and hair. Now let me explain one of the steps of our 550 nanometers handle. Following the same way. Wash the face with warm water. Then apply the gel. Wear eye masks. Then start to operate. During this operation, the energy usually starts from 1.0, then add it till customer feels some heat. Within the heat range that the customer can tolerate. This is a one-shot. When we were fighting. To fits the customer's facial contours. From the chin to the ears. To the corners of our mouths and ears. Nose to ear. I've been coming here all the time. Then focus on the pigmented areas. This is where the pigment needs to be improved. When we do it, we first hit the whole face once or twice. Then focus on the pigmented areas. About 5 to 6 times. When we fight, we step on the foot. Step out of the light. Next, let's look at the practical. During the treatment, you must always ask the customer how they feel. If don't feel it, keep adding more energy. Just feel it. But the premise is that the higher the energy, the better the effect. If the customer can accept it, we can continue with this energy. Where there is pigment, it will come out with a little redness. Probably the total pigmented area. Probably about 8 times. After you are done, clean the probe.